My name is Marcus Drake and I am a urologist helping with the PURSUIT study. This little video aims to explain a bit about the study. Urinary leakage with physical activity is called stress urinary incontinence, or SUI, and it affects about a quarter of women after pregnancy. The problem is in the bladder exit, which doctors call the urethra. Commonly, this weakness may be treated with a surgical operation. Unfortunately, symptoms can come back after treatment, a situation we call recurrent stress urinary incontinence. In some cases, symptoms may never have gone away after the operation, which is called persistent stress urinary incontinence. National Health Service hospitals have a couple of treatment options available for recurrent or persistent stress incontinence, and these include injections into the urethra to help it to resist leaking, and these are called endoscopic bulking injections. The injections are done with a medical instrument called a cystoscope, which is placed into the bladder exit, into the urethra. Surgical operations currently available include a strip of the patient's own tissue, which is taken from the tummy area, and this is used to support the urethra. The operation is called an autologous fascial sling. Alternatively, stitches are used to lift the vagina so that it supports the urethra, and that is called a colposuspension. Now, we do not know which of these treatments is best for women who have already had an operation or injections for stress incontinence. Given how important this is for affected women, the aim of this study is to find out whether surgical operations or endoscopic bulking injections are better for treating recurrent or persistent stress incontinence. People joining the study will be adult women with stress incontinence who have already had an operation or bulking injection for it. We aim to have 250 women participating in the study, with equal numbers of women getting endoscopic bulking injections or a surgical operation. Which group women will join will be decided by chance in a process called randomization, which is an important part of the research. It ensures that we can make certain that we compare the treatments fairly. For those women who join the surgical operation group, they will decide which operation to have on discussion with their doctor. All the treatment options offered in the study are standard NHS treatments. Women will receive their treatment and aftercare at hospital as they would during normal NHS care. People in the study will be asked to complete a questionnaire booklet, which will be given to them at the start of the study and at intervals over the following 3 years. The questionnaires cover general health, urinary symptoms, and the effect of those symptoms on everyday life and sex life. For some women, we may ask if they would like to give additional feedback by talking to a researcher who is a specialist in this type of interview. The PURSUIT study is fully based on what we already do in the National Health Service. It uses expert doctors and standard treatments. There is no additional risk to normal NHS practice of the endoscopic bulking injections or surgical operations, and neither are new or experimental. Women taking part will have the same risks as anyone having treatment for recurrent stress incontinence. This includes the possibility that the symptoms may not improve as much as women would like. The risks and benefits of each treatment will be explained by the doctors, and women will be provided with relevant hospital leaflets. We will respond properly to any questions that you have, and if you decide not to take part, it will not affect the care you get from your hospital. We aim to run the Pursuit study in 20 National Health Service hospitals across the United Kingdom. The study will run from now until 2025. It is funded by the National Institute of Health Research in its Health Technology Assessment Programme. It is sponsored by North Bristol NHS Trust, based at Southmead Hospital in Bristol. The Bristol Randomised Trials Centre, which is part of the Bristol Trials Centre, will be working from the University of Bristol, responsible for managing the study. Thank you for taking the time to watch this video.